Hello everyone, welcome back to my channel MedicosGuide. This is Dr. Ida Khan, and in this video we are going to be discussing about the shoulder and the shoulder girdle. That is basically chapter number 17 of the musculoskeletal physical therapy. Now here in this first paragraph they are talking about the function of shoulder complex, in which they are saying that this shoulder complex had a greatest mobility of all the joints. As you already know that the circumduction is also applicable at this joint. So it means that it allows the upper extremity to be moved in anywhere within the sphere of the movement. So the range is only limited by the length of the arm. So by the length of the arm, more area can be covered in the space. And due to the greatest mobility that occurs at the shoulder joint, the stability of the shoulder joint is significantly compromised. And that is why you might have heard that the subluxations and the dislocations are very common at the shoulder joint. Now they are talking about the composition of the shoulder joint, in which they are saying that the shoulder joint is made up of the 5 different joints. The 3 of them are the synovial joints and the 2 are functional joints. And yes, they are also supported by many different muscles that allow them to move smoothly, as well as they control their mobility. Now, just as with any other body region, when we are planning a therapeutic program for the shoulder joint, everything is kept into mind along with the pathology and the functional limitations, and these things are the structure of the shoulder joint as well as what kind of movements occur at the shoulder joint and to what degrees. So they are saying that the anatomy, kinesiological features as well as the pathology and the functional limitations, all of them should be kept in mind when designing a protocol or the exercise program for the shoulder joints. Okay guys, before we take a look at the structure and the function of the shoulder girdle, let us just take a look at the basic differences. The differences between the shoulder, shoulder joint, shoulder complex and the shoulder girdle, which is also referred to as a pectoral girdle. Now what is shoulder? Shoulder is basically a generalized area. It's a general area around the joint where the arm is connected with the body. So here you can see in this figure that this whole area would be referred to as a shoulder, in which the arm is being connected to the body. Now the shoulder joint is a glenohumeral joint, and this is basically the ball and socket joint where the humerus meets the scapula. So here you can see this one is referred to as the shoulder joint, which is a glenohumeral joint, and here the humerus is meeting the glenoid fossa of the scapula. So this is the shoulder joint. Now we have the shoulder complex. The shoulder complex is the entire region where we have different types of shoulder joints as well as the muscles, ligaments and the tendons. So here you can see this is the whole shoulder complex. Here we have 4 different types of joints: the glenohumeral joint, acromioclavicular joint, sternoclavicular joint, and the scapulothoracic joint is a functional joint that is located posteriorly. Additionally, the shoulder complex is made up of the muscles, ligaments and the tendons that are surrounding the shoulder complex. Now the shoulder girdle or the pectoral girdle. Now it is comprised of such bones that can attach the upper limb with the trunk, and these 2 bones are the clavicles and the scapulae. Okay, now let's talk about the structure and the function of the shoulder girdle. Now as we have seen that in the shoulder girdle, the upper extremity is connected or it is attached with the trunk. So here we can see that all of this structure, that is the shoulder complex, is connected to the axial skeleton via this single joint, and this single joint is the sternoclavicular joint. And this sternoclavicular joint is also referred to as the synovial saddle joint. So as you can see here that there is a very small contact area here, therefore there is considerable mobility, which means that there is significant mobility, and that's why, as we have already discussed, that there is mobility or the movement of the hand in all the areas. We can move the hand in the greater sphere of the movement. But because the movement is significant, the stability is significantly compromised, and this stability is depending upon the muscles, and these muscles are the scapular muscles, the glenohumeral muscles, as well as on the soft tissue structures. Now let's discuss about the joints of the shoulder complex. So as we have already seen that there are 5 different joints in the shoulder complex in total, and among them the three of them are synovial joints, and these three synovial joints are the glenohumeral, acromioclavicular and the sternoclavicular joints, while the other two are two functional articulations, and these two functional articulations are scapulothoracic and suprahumeral joints. Now let's discuss them one by one. Now let's take a look at the first joint of the synovial joints, and that is the glenohumeral joint. But before we get into it, I just want you to know that what is the concept of congruency and incongruency in the joints. So the congruency is basically defined in terms of how much is the surface area of the two structures that are forming the joint are in contact with each other. For instance, if the greater surface area of both of these structures are in contact with each other, the joint would be referred to as a congruent joint, and the stability would also be increased in such joints. We can take an example of the hip joint in such case. While if we say that a smaller or the limited surface area of both of these structures are in contact with each other, so that joint is referred to as an incongruent joint, and the stability in turn would also be compromised. And here the example would be of the shoulder joint. Now what are the characteristics of the glenohumeral joint? So the glenohumeral joint is incongruous, as we have already seen, because you can see that here is a very small surface area that is in contact, as well as the joint is very much shallow, as opposed to the hip joint, where we can see that a greater part of the femur is in contact with the acetabulum. So here there is a very shallow contact, and therefore this is an incongruous joint. Then this is also a ball and socket joint. Why? Because there is a spheroidal joint. It means that the head of the humerus that is in contact with the glenoid fossa is of the spherical shape, and it is in contact with the glenoid fossa. And now the glenohumeral joint is also triaxial joint. The word triaxial means that the movement is allowed in all the three axes. That is, in the longitudinal axis, in the sagittal axis, as well as in the frontal axis. Now this glenohumeral joint also has a legs joint capsule, and this is another factor why the mobility is greater in the shoulder joint. Now let's see what are the structures that are supporting the glenohumeral joint, and these are the tendons of the rotator cuff, as well as there are some ligaments, and these ligaments are the coracohumeral ligament and the glenohumeral ligament. Now this glenohumeral ligament has three parts, and these are the superior, middle and inferior parts of the glenohumeral ligament. So all of these structures are supporting this glenohumeral joint. Now as you know that whenever a joint is made, there are two different surfaces. The one is convex and the other is concave. Now this can be different, that maybe the movable joint is convex or it can be concave. Here in this case, the movable joint is convex, because the head of the humerus is in the convex shape, while the glenoid fossa into which this head of the humerus is attached is of the concave shape. So now let's first talk about the concave joint surface. So here, as we have already discussed, that the concave joint surface is a glenoid fossa of the scapula, and this glenoid fossa is located superiorly and laterally on the scapula. Now let's see the direction of this glenoid fossa. So this glenoid fossa faces laterally, somewhat anteriorly and slightly upward. So which means that when the humerus is going to be attached to this glenoid fossa in this direction, there is going to be minimal stability provided to the joint. So in order to increase the stability, there is the fibrocartilaginous lip, which means the band of the fibrous tissue, and basically this is to deepen the fossa so that the congruity, which is the increased surface area of the joint, can be made, and thereby the stability can be increased. So this fibrocartilaginous lip is referred to as a glenoid labrum. And now let's talk about the convex joint surface. So here in the shoulder joint, the convex joint surface is the head of the humerus. And this head of the humerus, they're saying that there is a very limited, a very small portion of the head of the humerus that is in contact with the fossa at any time. So, which means that there is going to be a considerable mobility. But if the mobility is increased, what is compensated? The stability is compensated. Alright guys, just to avoid making long videos, I am ending this video here. But up till now we have covered so many things. We have covered the differences, the basic terminologies, as well as so many other things, that now the other portions of this chapter would be easier for you to understand. And hopefully in the next video we'll be covering and completing this structure and the function of the shoulder girdle, which would be up till here. So yes, till here. Up till now, if you have any type of query, you may ask in the comment section below. And if you found this video helpful, don't forget to like, share and subscribe to my channel. And also hit the bell icon so that my new videos would appear to you and you may not miss them. See you in the next video. Bye.